Heroin is a derivative of opium which affects the reward centers in the brain, initially producing a rush of euphoria and providing pain relief. Those effects are short-lived, however, and a tolerance to the drug soon develops, so people take it again and again, in greater and greater doses, hoping to find that same rush. With continued use, a heroin user can expect a host of health issues, including a high risk for hepatitis C and HIV, dental problems, chronic respiratory illness, sexual impotence, skin issues, and depression. Heroin use is also associated with higher risks of being incarcerated, being the victim of violent crime, and early death. But the powerfully addictive nature of heroin makes an addicted person carry on using the drug despite these effects and consequences. It's important to understand that this addiction becomes a medical condition by changing the wiring of the brain, but help is available. The first step is detoxification. This can mean completely stopping all opiates or taking decreasing dosages of long-acting prescriptions to ease withdrawal symptoms and reduce cravings. Medically supervised detox is more effective as well as less uncomfortable than going it alone. Doctors can prescribe medicines to help ease the discomfort associated with withdrawal from both heroin and other substances often taken by heroin users. This is usually done on an inpatient basis. Ongoing medical maintenance is a tried and true approach to staying off heroin. Since the 1960s, countless people have found success through methadone, which activates opioid receptors in the brain but has a milder, longer-acting effect. This enables people to avoid withdrawal symptoms without heroin's many negative effects. Due to the potential for abuse, methadone is only available by daily visiting a specialized clinic, but newer medications that are formulated to reduce abuse potential are now available. These include Suboxone, which not only reduces withdrawal symptoms, but also blocks the effects of injected opioids, and Vivitrol, which is given once a month by injection. It's non-addictive and non-sedating and blocks the effect of opioids, making heroin ineffective and unappealing. But medical therapies alone are rarely enough. The best approach includes behavioral treatment to address underlying emotional and psychological issues that may have led to heroin use in the first place, along with issues that have developed due to heroin use. A support system of recovering people, family, friends, and treatment professionals is also essential to a lasting, gratifying recovery. To learn more about heroin addiction treatment, visit the Information Center at blakerecoverycenter.org or carrierclinic.org.